So I will basically start from what the stroke is. As you may already know, we have different kind of strokes. The common types, this is the hemorrhagic stroke and ischemic stroke. When we talk about the hemorrhagic stroke, this is the stroke which is caused mainly by a break in the wall of a blood vessel, and then the blood is coming out. And the ischemic stroke, this is the stroke basically caused by a blood clot. So there are two types of ischemic stroke. This is the embolic stroke, and how it comes. If a blood clot forms somewhere in the body, it can travel through the bloodstream, of course, to the brain. And once in the brain, the clot travels like to a blood vessel that is too small for it to pass through. It gets stuck there and stops blood from getting through. Second type is the thrombotic stroke. So here the blood flows through the arteries and may leave behind some cholesterol-laden plaques, and they stick to inner wall on the artery. And over time, the plaques are like sticking one by one and increase the size. And by increasing the size, they are narrowing or even block the artery, so the blood is not anymore getting through. When we talk about the about the hemorrhagic stroke, this is the stroke caused by a break in the wall of a blood vessel. So this break causes mainly the blood leak, and the blood leaks into the brain and stops the delivery of oxygen and all the nutrients. Hemorrhagic stroke can be caused by number of disorders, for example, long-standing high blood pressure or some enormous cerebral vessels. We have also something which is called TIA. This is the transient ischemic attack, and it's sometimes known like a mini stroke. So the signs, the symptoms are the same as a stroke, but unlike the stroke, they only last for a very short period of time. So the signs might disappear, for example, in a few minutes, but they can also take longer, but not longer than 24 hours. And this kind of stroke is very often a warning sign that a really stroke can occur. So depending on the location, we can observe different symptoms among our patients. So the cerebrum, this is the part of a brain that occupies the top and the front portions of the skull. So here we have the movement control, sensation, speech, thinking, memory, vision, and also emotions. And the cerebrum is divided into two parts, which we call also the hemispheres. And depending on the area or on the side which is affected by the stroke, some of those functions might be destroyed. Another part is cerebellum, and cerebellum is located beneath, behind the cerebrum, a little bit back to the skull, and it receives the information from the body through the spinal cord. Of course, cerebellum helps to coordinate the muscle action, the muscle control, coordination and balance, the main functions. Strokes of the cerebellum are less common but they might be really severe. So the patient who suffers from the cerebellum stroke possibly is not able to walk. He has some problems with balance and with the coordination. There is also a structure called brainstem, and this brainstem is a basis of the brain just above the spinal cord. And this is the main body's vital life support function controller. It helps also to control the nerves, which are involved in the eye movement, for example. And some common effects of a stroke in the brainstem include problem with the main vital functions, such as breathing, swallowing, heart functions. Unfortunately, the strokes which are located in the brainstem are highly lethal, so death is really possible with the brainstem strokes. Depending on the hemisphere which is affected, we can observe different problems. So right hemisphere stroke. So here we can have the left-sided weakness, paralysis, sensory impairment. We have left neglect, some problems with perception, with proprioception, inability to understand maps, finding objects. So all this orientation stuff, and also some behavioral changes. Whether the left hemisphere stroke, all the symptoms are located on the right side. So here we have the right side weakness, paralysis, sensory impairment. Those patients may have aphasia, some behavioral changes such as depression, hesitancy, and also impaired ability to read, write, and to learn new things. Despite the rehabilitation, about 25% of all stroke survivors suffer from some gait disturbance. This kind of patient often require some assistance. And of course, in a consequence of this gait disturbance, there are some difficulties in carrying out everyday activities and of course, moving from one place to another. The impaired gait of patients after stroke is mainly manifested by asymmetry in the individual phases of the gait cycle. So here we can have the short support phase with prolonged, like extended swing phase, of course, on the paralyzed side. We can commonly observe unequal load on the limbs, and we can have the disturbance in the step length. All this disturbance together with the muscle weakness expose people after stroke to the higher risk of falls. I know that some of you already are familiar with our Luna EMG, but for those who are for the first time attending our webinar, let me briefly introduce the robot and its main functionalities. So Luna EMG is a robotic device for training and also the assessment for orthopedic and neurological patients. And the most unique feature of this device is EMG triggered movement. So what exactly is the EMG triggered movement? The brain, here the intention to move appears. And by EMG sensors, which are applied on the patient's limb, those sensors capture the voluntary electrical activity of the muscle. So this is the EMG activity. And based on that signal, Luna EMG responds to the user desire to move by providing assistive movement and, of course, the real-time EMG biofeedback. And this positive feedback enhances much the brain plasticity and, of course, allows the biofeedback-based motor relearning. When we talk about the neurological rehabilitation, we, of course, have to point out the sensory-motor training. And this type of training consists of several stages. First stage, this is the training of the basic functions. What we mean by the basic function? This is the muscle force, the range of motion, coordination, the muscle tone. Then we go to the skill training. Cognitive, associative, and then we have the improvement of endurance on muscular and cardiovascular level. The treatment that focus only on function, as does, for example, muscle strengthening or the nerve stimulation, has really significant effects on function level, but fails to influence the activity level. So even if, for example, strength is really essential for a good skill performance, we need to involve more aspects in efficient movement strategies in order to train the optimal motor control. So all the active training approaches with most evidence of the impact on functional outcomes are task-oriented. So in the stroke patients, we focus the therapy to be more task-oriented. So when the patient has sufficient muscle force and the muscle coordination and the range of motion, it is pretty easy to introduce him or her to task-specific training, which is based mostly on the everyday activities. But if the patient does not really have that, he will definitely compensate, which might at the end lead to bad movement pattern or inappropriate movement pattern. So what should we do? We should try to improve those components to avoid those compensation if possible. This is the reason of implementing Luna EMG in the rehabilitation process and to train, of course, with patients. Here in this process, motor learning will still occur during the task-specific training, but the components like muscle strength, muscle coordination, range of motion should be trained on Luna EMG. Because sufficient repetition and the possibility to adjust the training to the patient capabilities, either by using the active assistive mode or unweighting conditions or with precise loading, leads to the better outcomes from the rehabilitation process. So now we are going to move to our case study for today. So this is the patient, 31 years old female. She suffered from hemorrhagic stroke of the left hemisphere of the brain in December 2012. And unfortunately, the stroke was located in the brainstem, so a very severe stage. She was on the ICU for several months, and for now she's like for 8 years of constant rehabilitation. What are the main problems which we have with Olympia? So right-sided paresis, and she's more spastic. Hemiparetic gait, she has some problems with walking as well. hypoesthesia, and aphasia. She has some problems with forming the phrases. She have some problems with memorizing the words. What we did in this case, we started our therapy with the assessment. So we assessed the balance, of course, sitting, one leg standing. We assessed the gait with the standardized functional tests like timed up and go, 10-meter corridor walking test. We assessed also the proprioception manually, and we have used Luna EMG diagnostic mode to assess the muscle activity. So all the assessment was made with the standardized functional tests. Okay, the first video I would like to show is about the balance testing in sitting position. So you can observe there is lack of internal rotation in the right hip joint because the right calf should be positioned as a left calf. Another test, the timed up and go through left and right leg. And already during the testing procedure, we can observe how the hip and how the foot is positioned during the walking. She can walk without the assistance. For this test, we ask her to take off her orthosis. Another test assessing walking. This is the corridor walking test. The corridor was 10 meters long, and we wanted to observe and assess the walking speed. Another balance testing. This is the one leg standing. She had 3 attempts on each side. So standing on the left leg, you can see there are some adjustments, some adjustment reactions, but she could stay on the left leg like without bigger problems. She's shaking a little bit, losing the balance, but she's able to do that. Whether the standing on the right leg, she couldn't stay longer than 2 seconds. She had 3 attempts and all the attempts were less than 2 seconds. Another test was about the weight loading, so transferring the body weight from one leg to another, and she achieved around 54 kilograms for the left leg and 48 for the right leg. And as you could see, the loading right side was less willing, less sensitive, and of course, less controlled. EMG in Luna is used to observe and to diagnose the patient in such a way that the activities which are undertaken by the therapist are stimulating. So we also assess the muscles with the use of the EMG sensors. For this test, we assess the movement of the foot. Here you can observe the comparison of the left and the right side and several movements, the dorsiflexion, plantar flexion, supination, and pronation. And pronation movement was impossible. Pronation was impossible. And the tiptoe standing, very difficult, almost also impossible without help. Then we assessed her with the EMG diagnostic program in Luna. So electrodes are placed on fibularis muscles, both left and right. And the task was to do the tiptoe standing And later on, she did the dorsiflexion and the plantar flexion for both legs. And the dorsiflexion, the left leg, she achieved around 19 microvolts, and the right only 8. And the pronation, as you could see at the previous video, was also almost impossible. For the proprioception assessment, the patient's task was to copy the movement, or rather the position of the right lower limb through the left limb. Of course, the action was with the eyes closed. And in the foot area, we can observe that there is lack of movement. She wasn't sure about the position. She was guessing. So we can conclude that she has some sensation disorders in this foot area. So the damage after stroke is more on the sensory level. When we go more higher to the knee and to the hip, she was able to copy the position with another leg, but still the foot, she was not able to show the position, to copy it. Right. Everything was fine above the foot. Okay, and based on the assessment, we already had some tasks for Olympia. So the therapy was very simple, because by showing simple exercises, we wanted to present the possible way of therapy. So simple assumptions that have really certain intention, and we wanted to show you the logical sequence of events, and that this sequence can be therapeutic. And this is an example on like how Luna EMG can be implemented, of course, selectively into the therapy. Because we could observe during the diagnostic that she has some weakened muscles. And then we can think about what cycle should I use at the beginning. Should I start with the EMG biofeedback to teach how to contract and how to release the muscles, or how to teach the patient to define the muscle? Because the patients often have some disorders on the sensory-motor level, and this is not really defined in the homunculus. So for the therapy, we decided to make several exercises. The proprioception training, because it was the biggest problem of this patient. Trigger and hold, so reactive electromyography for peroneus longus and tensor fasciae latae. And then we combined the hands-on therapy, so the Pnf method, together with Luna EMG. First therapy, the proprioception. Our first try, we chose the proprioception visible position, and the patient task was to move the foot to reach the field which is marked on the screen, and keep the foot in this place for the certain amount of time. And what is important, that we set the range of motion passively, and it turned out that the patient couldn't reach the final range of motion during the exercise, and it was really difficult for her. I can see that some questions. What is PNF? This is the proprioceptive neuromuscular facilitation. This is the one of the hands-on neurologic therapeutic methods commonly used in a therapy of neurological patients, so stroke survivors, the spinal cord injuries, and it's the concept used mostly with the hands on. Okay, for the second probe, we redefined the scope of work. And in this exercise, she actively set the range of motion. We choose a longer position holding time. We choose 4 seconds of holding time to activate the strength fibers for the patient. And we started the exercise, and it started to be feasible. Another exercise, the trigger and hold for the fibularis muscles. Contraction holding time for this exercise also 4 seconds to activate the slow motor units. And here for this exercise, Luna is really a fantastic device. Why? Because it enables training of the muscle contraction in the full range of motion. So this exercise also is used to train the proprioception for our patient. But the main goal is to train the dorsiflexion and the plantar flexion. Of course, the proprioception here, the component, because the patient is more focused on the foot. This is the kind of type, task-oriented therapy. So the patient is very focused on achieving the goal. Another task, also trigger and hold reactive electromyography. And here we choose the agonist mode. What is agonist mode? That 2 muscles must be contracted and must be over the threshold line as it is presented on the screen to get the assistance. And 2 muscles must be responsible for the same movement. So here for the red channel, we put the fibularis muscle, and for the blue channel, tibialis muscle. And both muscles should be active to get the assistance from Luna EMG in the agonist mode. This is one of our new functionalities. We have also the antagonist mode and the relaxation. So you can train your patient more detailed way. Last but not least, the trigger and hold hip joint abduction. In this exercise, we must always remember when we talk about the lower limb to set a high, even maximum moment. We take into account that the limb has some weight and that we want to work on a longer lever. So here electrodes were placed on the tensor fasciae latae, and we made the abduction in global pattern. So the movement from the foot pronation up to the full abduction. And we have to remember that pelvis is in intermediate position. And for this exercise, also the contraction keeping time is 4 seconds. As I mentioned you before, that during walking, this full support phase and the loading response phase, the hip joint is in a full extension. So therefore, for this exercises, we proposed lying position to train the walking function, walking component for the hip in full extension. And this Pnf and trigger and hold combination, sometimes, of course, you have to go down to lower position to isolate the movement and to plan really simple exercises so that the patient can start moving against the force of the gravity and start with any activity at all. So here Luna allows you to observe this because it's equipped with the real-time EMG. So you can start moving against the force of gravity at a later time. And in this exercise, you can observe how Luna EMG can be combined with hands-on PNF therapy, because physio is actively working with the position. And he was also made some movement on the muscle before to get the muscle more activated. And then he assisted with the position. And her task was to go from full pronation, foot eversion, up to the abduction. According to Merholtz, robotic gait therapy, of course, in combination with conventional therapy, is much more effective than standard physiotherapy alone. And every fifth dependency in walking after stroke actually can be avoided if some robotic assistive devices are used. In particular, all the non-ambulatory patients in early rehabilitation profit the most from robot assistive therapy. And people who receive robotic assisted gait training in combination with standard physiotherapy, for example, after stroke, they're more likely to achieve independent walking than people who receive gait training without help of this device. Especially benefits the patients who in the first 3 months after stroke got this kind of treatment, and those who are not able to walk seem to benefit from most type of this intervention. And also people in the acute and subacute phases after stroke profit much more from this type of therapy. And the greatest benefits in regard to the independence in walking can be achieved in the participants who are non-ambulatory at the start, and for those whom the intervention is applied very early post-stroke. That's why it's very important to start immediately after stroke. And of course, with Luna EMG, you can start just right away in the ICU. Another question coming. I will answer your question after the webinar, if it's fine. Right. So to conclude, the application of the EMG-driven robotic training in everyday therapeutic process is really modern and innovative form of the neurorehabilitation among patients after stroke. Rehabilitation of lower limb after stroke, which is supported by robotic device, aims to return the independence and to minimize the disability caused by the incident. And last conclusion from this slide, that EMG triggered therapeutic program create an interaction, the very important interaction between the neuromuscular system and the robotic device. And the electromyography technique provides more complete information about the patient's current muscular state. So we can observe one muscle or even the entire muscle group. If patient does not improve the proprioception, he will not improve the function. And the brain is activated by achieving the goals, not only by the quality of the movement, which is often compensated. So here we talk about the task-oriented therapy, and defined by the patient functional disorder. So when the patient defined as where is the problem, and then we put our diagnostic. So our examination at all levels, so sensory, motory, endurance, and we assess also the strength, then we can create the comprehensive image of the therapy that we build to improve the functions. A great thank you for help to our great key opinion leader, Mr. Wojciech Romanowski, a great PT from Rehabilitation and Orthopedic Center in Bielsko-Biała. He really helped us to make this material for the webinar, together with Olympia, the patient. Also very many thanks for letting us record the physio session. And just to give you the idea, we are the clinical team of Exotech. So here you can see this is Anna Poświata, me, and Kasia Bienias. Some of you might be already familiar with our team. So the clinical team is happy to help you whenever you need our help. We are happy to answer your questions, to give you to support you with clinical information. We can provide you a training. So if you have any questions and you need any help regarding working with Luna EMG, just let us know and write us an email. So I will leave our email here. You can write either directly to me, this is my email address, or to the office, which is office@exotech.com. So I would like to thank you for today's session, for today's webinar, for your attendance. And of course, I am happy to hear your questions if you have any, and to answer them.